Hello, everyone. Welcome to my YouTube channel. My name is Silvana. I'm a certified functional nutritionist, and I cover topics pertaining to women's health. Because May is the month of Mother's Day, I decided to cover topics such as the role of women in healthcare, the flawed use of the body mass index, fertility, more particularly male factor infertility and its role in miscarriage. And we're going to close the month off with perimenopause and menopause because it's an important topic to cover, and a lot of women are experiencing it and aren't really receiving help. So let's dive in. Let's look at how the Cleveland Clinic identifies perimenopause. Perimenopause is when your body starts transitioning to menopause. During this transition, your ovaries begin to produce less hormones, causing your menstrual cycle to become erratic or irregular. In perimenopause, your body is moving toward the end of your reproductive years. It's a natural and normal progression, but it comes with both physical and emotional symptoms. Some of these symptoms can disrupt your life or make you uncomfortable. Perimenopause may begin as early as your mid 30s or as late as your mid 50s. Some people are in perimenopause for only a short time, while others are in it for several years. Even though your menstrual cycles are unpredictable and your hormone levels are declining, it's still possible to become pregnant in perimenopause. Perimenopause is a transitional time that ends in menopause. Menopause means your periods have ended. When you have no menstrual cycle for 12 months in a row, you have officially reached menopause. One thing I'd like to add to this is that even though we don't need as many hormones in menopause, we do still, in fact, need those hormones. We need hormones such as progesterone, testosterone, and estrogen. And because our ovaries are no longer producing them in menopause, that role shifts to the adrenal glands. Let's keep going. Okay, now let's talk about symptoms in perimenopause as described by the Mayo Clinic. Irregular periods. As ovulation becomes more unpredictable, the length of time between periods may be longer or shorter. Your flow may be light to heavy, and you may skip some periods. If you have a persistent change of several days or more in the length of your menstrual cycle, you may be in early perimenopause. If you have a space of 60 days or more between periods, you're likely in late perimenopause. Hot flashes and sleep problems. That is a frequently described symptom of women in perimenopause. Hot flashes are common during perimenopause. The intensity, length, and frequency vary. Sleep problems are often due to hot flashes or night sweats, but sometimes sleep becomes unpredictable even without them. Mood changes. Mood swings, irritability, or increased risk of depression may happen during perimenopause. The cause of these symptoms may be sleep disruption associated with hot flashes. Mood changes may also be caused by factors not related to the hormonal changes of perimenopause. Let's keep going. More symptoms according to the Mayo Clinic. Vaginal and bladder problems. When estrogen levels diminish, your vaginal tissue may lose lubrication and elasticity, making it more painful during intercourse. Low estrogen may also leave you more vulnerable to urinary or vaginal infections, and loss of tissue may also lead to urinary incontinence. Decreased fertility. As ovulation becomes regular, your ability to conceive decreases. However, as long as you're having periods, you are still able to become pregnant. Changes in sexual function. During perimenopause, sexual arousal and desire may change. Loss of bone. With declining estrogen level, you start to lose bone more quickly than you replace it, increasing your risk of osteoporosis. Changing cholesterol levels, and this one's a biggie. Declining estrogen levels may lead to unfavorable changes in your blood cholesterol levels, including an increase in low-density lipoprotein, LDL cholesterol, or the bad cholesterol, which contributes to increased risk of heart disease. At the same time, high-density lipoprotein, HDL, the good cholesterol, decreases in many women as they age, which also increases the risk of heart disease. Let's keep going. In this next section, we're going to talk about progesterone. And I really like the article by Tara MD. So we're going to dive right in. because I believe that it's an important and not often talked about sex hormone. We usually hear about estrogen, but certainly not enough about progesterone, so let's dive right in. In perimenopause, estrogen gets a lot of attention. Its wild fluctuations and eventual decline are responsible for many uncomfortable symptoms. However, progesterone is equally important. For many women, progesterone decline contributes to the first perimenopause changes, even before you experience changes in estrogen levels. It actually starts dropping first. We can't talk about perimenopause without a deep understanding of the progesterone hormone. So that's exactly what this article is about. I'm going to include that in the links as well so you can read the entire article on your own. Let's keep going. Okay, the top part of this next section covers progesterone's role in fertility, but because this is a perimenopause video, I'm going to skip towards the middle. Your body relies heavily on progesterone with progesterone receptors and signaling pathways throughout the body. Why? Because it's a chemical messenger. Progesterone benefits go far beyond reproduction. In fact, you make much higher levels of progesterone than estrogen. And some of the health benefits that you may not be familiar with are progesterone calms the brain and the nervous system. It reduces anxiety, promotes sleep, reduces inflammation, supports immune balance, protects the heart, increases body temperature and metabolic rate, protects breast health, has anti-androgen properties, builds bone. Given all these roles, it's beneficial for overall health and disease prevention to have ovulatory menstrual cycles and progesterone production for as long as possible. Note that birth control methods that suppress ovulation, such as oral contraceptives, don't allow for the body's natural progesterone production. On to the next slide. Here we're going to cover the effects of perimenopause on progesterone. During perimenopause, progesterone and estrogen levels decline, even though estrogen levels fluctuate, especially in early perimenopause. The overall trend is down. Given how these sex hormones benefit tissues throughout the body, it's no surprise that declining hormones lead to perimenopausal symptoms. As you move into perimenopause, the corpus luteum prompts out less progesterone after ovulation. You may experience cycles with a shorter luteal phase, meaning less progesterone production. Eventually, you'll have anovulatory cycles when ovulation does not occur and no progesterone. Okay, here we will cover symptoms of low progesterone. In perimenopause, progesterone levels can be the first to decline, which can lead to symptoms of progesterone deficiency. Low progesterone also causes an imbalance between estrogen and progesterone, so it may present similar to high estrogen or estrogen dominance. In the early stages of perimenopause, it's common to experience low progesterone symptoms while the menstrual cycle is still regular. In late perimenopause, when you begin skipping periods, symptoms of low progesterone may be more pronounced. And some of the symptoms include short luteal phase of menstrual cycle, cervical mucus, or the fertile mucus at the wrong time of the month. You should typically see that 5 days before the ovulation. Spotting before your period, prolonged period bleeding, heavy periods, PMS, new or worsening migraines, decreased fertility in miscarriages, trouble sleeping, especially in the luteal phase, increased anxiety or depression, decreased resilience of stress. Okay, next we're going to talk about the effect of low progesterone on GABA receptors. One of the most interesting roles of progesterone is how it directly interacts with GABA receptors, which is the body's most calming neurotransmitter. Progesterone stimulates the GABA receptors, producing an antidepressant, stress-reducing, and slightly sedative effect. With declining progesterone in perimenopause, sleep disturbances, mood changes, and decreased resilience to stress are common. Progesterone levels in women at all stages of life correspond with psychological resilience, well-being, favorable mental health, lower levels of perceptive stress, life satisfaction, and better mood. So it's not hard to see how declining progesterone in perimenopause make you more sensitive to stress and everyday life more challenging. While your life and habits may not have changed, you may not feel as positive, energetic, and vital as you once did. Many women get brushed aside by the medical system in perimenopause because these initial changes are hard to measure. In actuality, symptoms are very real and related to hormonal changes because menopause doesn't automatically switch on, it's a transitional stage. Okay, now we're going to talk about stress in perimenopause and menopause. So let's dig in. Adrenal health and the HPA axis aren't only concerns in perimenopause, they actually become more important in postmenopause. After perimenopause and menopause, the 1 year mark without a period, you enter the postmenopause phase, but sex hormone levels don't go to zero. You still get some hormone production coming primarily from the adrenal glands. Take note. With the ovaries offline, the adrenals are the primary producers of DHA sulfate, testosterone, estrogen, and a tiny bit of progesterone. If the HPA axis isn't functioning correctly and the adrenals are sluggish from decades of chronic stress, they may not be able to produce sex hormones optimally, and you could miss their benefits. So, I know that there's no way to completely remove stress from our lives, but there are things that we can do to modulate and to improve stress resilience. There are absolute lifestyle modifications that we can make to help our bodies function properly, especially as we head into perimenopause and menopause. So let's keep going. Okay, in the next 3 slides, I have included actual studies pertaining to adrenal health and perimenopause. So if you'd like, you can stop to read them or pause to read them because we have a little bit more to cover. So check these out. Okay, now we're going to talk about how to support our adrenal glands. Even though it is not possible to remove all stress from our daily lives, we can absolutely do certain things to support our adrenals. As we move into perimenopause and menopause, our adrenals are going to take on more of a role in the production, especially in menopause, postmenopause, in the production of sex hormones. So we want to do the best that we can to support our adrenal glands. Okay, Tara MD recommends regulate your circadian rhythm, go outside for a few minutes, get some of the sunlight. Our bodies respond specifically to sunlight. There is a feedback loop. It's super important, especially for your HPA axis. Optimize protein, 30 grams per meal if you're able to. Increase minerals. And Tara MD recommends minerals, including sodium. Obviously, sodium is going to be important. Sea salt, seaweed, herbal teas like nettle, electrolyte supplements. I'm going to disagree with the electrolyte supplements unless you're an athlete that is going to be running tons and tons throughout the day. Just a little bit of sea salt in your water. Some of the other recommendations, a little bit of lemon or coconut water should be sufficient to replenish your electrolytes. Micronutrient needs, and this is where your digestive system is going to play a role. In hindsight, if your digestive system is working properly, you shouldn't be needing additional multivitamins. If you're consuming a whole foods based diet with a properly functioning digestive system, you shouldn't need this. So, this is going to be very individualized. Adaptogenic herbs. If I had to recommend any one of the things to purchase, it would not be electrolytes. It would potentially not be multivitamins or a vitamin. It would be adaptogenic herbs. However, all of this should absolutely be done under the guidance of a professional because you can do more harm than good. I significantly disagree with self-supplementing. I've seen it do harm, including in myself, and I just don't think it's recommended. It should be done. Caffeine. Reduce your caffeine consumption. Believe it or not, I was one of those. I loved my coffee. I've been without coffee for several years now. It's just not going to help you. You can pause to read why. You can maybe move into decaf. Be sure that it's Swiss water decaf, and then potentially Wean yourself off all of actually coffee, period. There are other drinks. Some are adaptogenic drinks. There are matcha. I love matcha. Matcha is a wonderful adaptogenic drink that I would recommend if you enjoy it. Exercise, but not too much. Too much exercise can actually harm your adrenal glands. So pay attention to your body. And then increase parasympathetic activities and potentially consider bioidentical hormone replacement therapy. This should always be done. The bioidentical hormone replacement therapy should always be done under the guidance of a professional. If you're talking to a doctor or a functional medicine doctor, whether it's anybody, be sure that they have actual training in the field of hormone replacement therapy. And there's a reason why I'm saying this. We'll go into it a little bit later. Let's keep going. Okay. Healthline also has some recommendations on how to manage perimenopause symptoms. Some of these are going to be repeats. You can pause to read. I'm going to go through them very quickly. But you've already heard me talk about protein. There's a reason why protein is important in every meal. You can pause to read this one, and then we'll move on to the next one. Exercise is going to play an important role in insulin sensitivity, insulin resistance as we move into perimenopause. But remember, not too much, not an excessive amount of exercise, especially if you're dealing with adrenal issues. Take heed and do not overdo it. Pay attention. Listen to your body. Gut health is going to be super important here. And just because you aren't experiencing belching or gas or acid reflux does not mean your gut health is optimal. Because of the way we live in this country and our standard American diet, the majority of Americans are going to have some sort of compromised gut. So this is going to play a pretty significant role in perimenopause and menopause. Healthline says reduce sugar, lower your sugar. I'm going to say completely remove all processed sugar. There is zero benefit to sugar. There are other ways you can eat sweet things and sweeteners without compromising the health of your entire body. So in my opinion, I'm going to say completely remove sugar. If you want to know more about the reasons why, you can pause this here. But this removing sugar is actually going to be in my top 5 recommendations for improving perimenopause and menopause symptoms. Let's keep going. Healthline says reduce sugar, lower your sugar. I'm going to say completely remove all processed sugar. There is zero benefit to sugar. There are other ways you can eat sweet things and sweeteners without compromising the health of your entire body. So in my opinion, I'm going to say completely remove sugar. If you want to know more about the reasons why, you can pause this here. But this removing sugar is actually going to be in my top 5 recommendations for improving perimenopause and menopause symptoms. Let's keep going. Consume healthy fats. Healthy fats, such as omega-3s, help increase insulin sensitivity by preventing cortisol levels from rising during times of stress. Get consistent, high-quality sleep. We already covered this. Pause to read. Last one. High fiber diet for perimenopause, menopause, postmenopause, PCOS, trying to conceive. For women, period, high fiber diet. I know that there are going to be individuals who cannot consume high fiber foods. This is why it's super important to work with a certified functional nutritionist who can get you there. Fiber is important for so many reasons. Let's move on. I have just a couple of little things to say before we finish off. Last little bit, I wanted to talk about why so many women in perimenopause are not diagnosed and don't receive help from the medical community. I follow Dr. Mary Claire Haver. She's a board-certified OBGYN, has been in the field for a really long time. She currently has the Pause Life and helps women with perimenopause and menopause. So she sees 3 different challenges in the field. Number 1, there's no standard criteria for diagnosis. The problem starts at the beginning. There's no official method of diagnosing perimenopause. This means that different physicians may diagnose and treat perimenopause differently based on their training and experience. She says, without a standardized way to diagnose perimenopause, symptoms are like pieces of a puzzle that must be put together using a detective style approach. I want to back it up a little bit. This is exactly where certified functional nutritionists are able to help. We work between the doctor and the patient. We work in the middle ground. In prevention, we look at functional ranges versus conventional ranges, where conventional ranges are looking for menopause. They're looking to diagnose for menopause. But if you're experiencing symptoms of perimenopause and those gradual shifts in perimenopause, a physician wouldn't be able to catch that. And because so many of the improvements are already lifestyle recommendations, this is exactly where a CFNC is able to help women in perimenopause and menopause and beyond. Let's move on. Challenge number 2, lack of awareness. Unfortunately, perimenopause just isn't on the radar for many physicians. Some may be quick to look at symptoms like fatigue and mood changes and attribute them to other issues, missing the root cause or causes of the problem. Historically, there has been insufficient research and healthcare industry emphasis on women's health, and this is exemplified in the lack of awareness of perimenopause symptoms, diagnosis, and treatment. Cue to my very first video about women's role or lack thereof in health care research. It's the very first video I ever posted. Many physicians do not routinely screen for perimenopause symptoms. Often, the possibility is only discussed when symptoms are severe or when patients have learned about the symptoms on their own and tell their doctor. The lack of proactive screening can lead to delays in diagnosis and leave people suffering from symptoms without hope for improvement. Okay, last one. Last challenge. Challenge number 3, lack of training. It may come as a surprise to learn that many physicians receive very limited training in menopausal medicine. In one survey, 80% of medical residents reported feeling barely comfortable discussing or treating menopause symptoms, and only 20% of OBGYN residency programs offer menopause training. When I first heard Dr. Claire Haver discuss this topic on a podcast, she admitted that she only had 6 hours of menopause training in medical school. So, very last thing, moving on, I will leave you with my top 5 perimenopause and menopause tips. Okay, last bit, medical implications of a missed perimenopause diagnosis. Hot flashes, night sweats, mood changes, weight gain, hair loss, and many other symptoms can certainly have a negative impact on quality of life, but it's important to identify that there are other medical conditions that can arise from declining hormones, such as developing cardiovascular disease, osteoporosis, cancers, and so forth. Identifying perimenopause at an early stage is important. And lastly, my 5 top recommendations on how to improve symptoms. First thing is going to be removing all processed sugar. I know what you're thinking, and it can be done while still indulging. Number 2, adrenal health. Number 3, high fiber. Number 4, whole foods diet, including protein. Number 5, exercise. That's all I have for you today. Hopefully you found this video interesting and helpful. Tune in next week and we'll all find out what I'll be talking about.